with all these data sets, basically with complex algorithms, a lot of mathematical functions, all the data, no matter how, and it's multimodal, so no matter how it comes in, some of it's video, some of it's text, some of it's images, whatever it is, all those get essentially translated to ones and zeros, right? Translated to numbers. And those numbers is really where mathematical functions and complex algorithms kick in. And what happens is then when you put a prompt in, and you might put a prompt in that says, fill in the sentence for me. Um, Masoud loves to X, whatever it is, fill it in. And, based on what data it's been trained on, it may know the answer, it may not know the answer. So you asked the question around limitations. We've seen this all the time. How many times do we get frustrated with asking Siri a question and Siri has no idea what the heck
Yeah.
to say? And it's frustrating. And then, or even worse, instead of saying I don't know, it gives me a completely different answer. It's like, oh my gosh.
It's trying to please you. Hello and welcome to the Chris Wolfe Podcast on iCode Media. Today I had a great conversation with my new friend, Masoud Nafey. And we discussed AI, we discussed the practical applications of large language model within AI, as well as kind of the transition into AI agents. And then I did dream a little bit about what might happen in the future with AI, although he did not let me go down that path too far. So please enjoy our conversation. As always, be sure to subscribe to the podcast, write a review, share it with your friends, and support those who support us. Hey, iCode Media listeners, want to know how AI is really going to impact your practice? Join us Tuesday, June 24th in Minneapolis, right before the AOA for the kickoff of the Gateway Tour. It's a full day, live workshop where your whole team learns insights and team building exercises together. We'll demystify AI, explore how data and tech are transforming optometry, and dig into real strategies to optimize performance clinically, operationally, and culturally. You'll experience a live AI workshop, learn what's working in other industries, and leave with a roadmap to lead confidently into the future. Reserve your team's seat now at gatewayculture.com. The most common questions I get include, what ophthalmological codes or evaluation and management codes should I use? What ICD-10 codes do I need to bill with this CPT code? What CPT codes can be billed together and what can't? And my favorite, how do I manage a patient who has diabetes who comes in for a quote-unquote routine eye exam? These questions really highlight the confusion and uncertainty that serves as a daunting hurdle for providers, makes it more challenging for them to care for their patients and provide those patients with the best opportunity for a lifetime of ocular health and clear vision. That's why we built iCode Education for this specific purpose. Our mission is to provide optometrists with resources to help you understand disease states, revenue cycles, and billing and coding so that you can put that on autopilot and truly care for your patients. Check out iCodeEducation.com. That's EYECODE education.com. We've developed a premier billing and coding bundle that includes all of our billing and coding resources in one place. We also have a 10% discount code just for listeners of this podcast. Enter the coupon code EYECODEMEDIA22 at checkout. We'd love to work with you. Check out iCodeEducation.com. Hello, dedicated optometrists. Are you looking for a way to support your patient's vision and overall eye health? Let me introduce you to Vision Edge Pro, a visual performance supplement that stands out in our profession. Vision Edge Pro contains a balanced blend of mesozeaxanthine, lutein, and zeaxanthine in a 10-10-2 ratio. This combination has been scientifically shown to increase macular pigment density, which enhances visual performance, including contrast sensitivity and vision in glare situations. Additionally, Vision Edge Pro provides 300 milligrams of DHA and EPA, fulfilling the daily requirements for omega-3s as recognized by the leading health organizations. This ensures your patients receive the essential nutrients their eyes need for optimal health. Whether it's for everyday screen use, night driving, or enjoying the outdoors, Vision Edge Pro supports your patients in seeing their best. Recommend Vision Edge Pro for your patients today and help them achieve clearer, healthier vision. Contact your local MacuHealth representative for more details. Vision Edge Pro, because your patients deserve the best in eye health. Go to MacuHealth.com and use the coupon code PODCAST2024 at checkout for special discounts. That's correct?
Yeah, there's three correct ways to say my last name. So
All right.
Nafey's perfect.
All right.
Has a lot of origins.
Does it?
Yeah.
What's the origin?
Well, so originally I was born in Afghanistan, so that's the original where it kind of came from, but it has an Arabic origin to it, um, a French piece to it. So that's why in Afghanistan they'll say Nafey,
Hmm.
and then in Arabic they'll say Nafi, and then of course I've always said Nafy, and everyone's always said Nafy here in the U.S. So
Yeah. How long you been in the U.S.?
I was 5 when I got here, became a U.S. citizen, and didn't know a lick of English. So I started kindergarten and I learned how to say hello.
Yeah. Wow, that's awesome. Well, so you and I had a long discussion about AI, and
Yeah.
I think that it would be really helpful, especially as we sort of build some of the gateway tour and some of the assets that we're thinking about building or that we are building for Vision Source. Is to think maybe about what is AI and what are the differences and of what people think of as AI currently, and then what is AI in the future. So, maybe we take a little bit of a step back and kind of give an overview for the listeners about kind of your background into technology from an eye care standpoint. So, how do you go from being an optometrist to developing and helping with EHR developing, and then how does that parlay into AI?
Yeah, so not a usual journey. I think I was really just curious about how to solve some problems that we were facing, and serious problems, in my opinion, that we were facing in our own practice, on how to be more efficient and take better care of our patients. And then I started to look at tools, and I started to realize that tools were some of the problems, not the solutions, in terms of what we needed. So that naturally got me into actually first a consulting role that allowed me to go build clinics for all the big members, I should say the big clients for VSP Global. So that's I had a lot of executives that were my patients, so we built relationships, and then otherwise they also saw how kind of my clinic was being run, and seeing that practice, they're like, what, we want something similar to this in a very small footprint, and we needed it on site. So I actually built all those clinics in Meta, Google, Apple, 3M, Intel, and some of those places. So they're kind of employer-run facilities. The
So
vision
you're
clinic
not.
they never had.
So the local ODs in those areas probably don't like you very much.
Well, I don't know. It's not really. It wasn't my business venture. So it was VSP's business venture. But the thing is, this actually came from the client. So this came from the Intels of the world, the Apples of the world. Like, they already have healthcare facilities, right? They didn't have vision. So they're
Mm,
like, well, we want vision here too. So either, and how it kind of went was they either wanted VSP to do it, or they were going to find someone to do it, right? To
yeah.
just build the clinic. And then of course they hired them optometrists and handled all of it themselves. So it was going to happen. It already happened to every other specialty, but obviously you can't
Every
do it
other
all in
specialty.
there.
So yeah. Actually, this is really interesting. It's not where I thought we would go, but so like those big companies like Apple, how many people work for them, and then how many specialties do they have?
They have a lot. I mean, they have an entire healthcare facility, but it's mostly primary care, right? You're not going to go there and like expect surgical care, or secondary or tertiary care.
Yep.
But if you have something going on, they have nurses on site, they have doctors on site, they have things that you could do. You can go get an eye exam on your break, right? You're on your lunch, or um, they have a lot. Like Stanford actually powers, and me being faculty at Stanford, I know a little bit about now, kind of that side of it too.
Hmm.
But Stanford powers some of those healthcare facilities, the greater ones. And again, nobody really knows how to do vision, right? Nobody really knows how to do the optical side very well, and all of that. So that's kind of why they called on VSP for help.
Yeah. And then so VSP brings you in to help build that footprint. And
Yeah,
so are the doctors in those places like for the doctors that the eye doctors in those places, you
yeah.
said, around their breaks or around their lunch breaks, are they kind of condensed in their hours or people just kind of take breaks as they need them to go visit the
Yeah.
doctors?
Yeah, no, people we can go anytime. And
Yeah.
honestly, they're usually booked all day.
For how many
Yeah.
people? How many patients in those areas?
Well, everyone who's an employee in that facility can go get their care if they wanted to. They just go downstairs, go into the healthcare building, and they get their care. And
Yeah.
um, obviously there's when you step back and you start looking at the business landscape and what corporations look at, they want healthy employees. Healthy employees tend to be productive employees, tend to be happy in their home life, happy in their work life, and all of that leads to obviously results.
Yeah, being in your practice, but you didn't find anybody else in those areas that said, you know, Masoud, I can't believe you're doing this. People just didn't. They didn't like view you as the bad guy in those areas.
No, I mean, again, I've always been kind of the behind the scenes guy anyway. I'm just building clinics, right, at this point, and somebody needed to build it. So something I knew how to do, and I wanted to make sure everything was digitally integrated. And I think that was the biggest difference between
Mm.
any optometrist maybe building a clinic. It's more around how do you get a fully digitally integrated uh, eye exam experience, essentially, right? That's also very seamless with the optical, and you kind of total footprint. You have very small footprint, so try to make it all work in a very small footprint is another
Yeah.
challenge.
Yeah, and then the challenge, obviously, as a practicing OD, is how do I get the how do I get the patient information about whether or not they're eligible and who's going to pay for what, and then how do I get the clinical information to sync with the optical information, and then also how do I order stuff? Like that's the other thing. It's like none of these systems are built soup to nuts. Like I gotta, patient comes in and orders a pair of glasses, and I got to be able to sell it to them 5 different ways if I take 4 different vision plans, and then I have to be able to order it from 5 different places, and I might order it 3 times. Once in the EHR, once with the managed vision care plan, once with the optical lab that I'm using, right? So there's all these complexities, and you see some of those complexities. And that kind of spawns your move into EHR. Is that right?
Yeah, exactly. So, one thing that happened is as I started to solve problems there, naturally I saw where kind of the rate limiting steps were, and then I transitioned into okay, so had the opportunity to start building out essentially what today is known as Ifinity EHR. And knowing that now all these clinics were using Office Mate Exam Writer at the time, which was an Ifinity asset, and their only asset really. And then at the time they were thinking about building out this SaaS model, something going on in the future of technology. How do we make this better? And I was basically brought in to help with that. There were some struggles for sure. There wasn't a lot of adoption. Practices weren't using it. Honestly, it wasn't even halfway baked, if you asked me. Probably not
Mm.
even 20% of the way at the time. So that's probably why only 3 doctors were using it, right? And all of them weren't paying for it at the time. But um, when I came in, took over product, supported on all sales and marketing efforts. And what I did is, and I was still practicing too. So I, wanted to make sure that, and I think, look, the biggest thing I see in tech companies today, and probably the biggest opportunity for them, is to be obsessed with their customer. Truly be obsessed with your customer, and you'll probably build a product that has great product market fit because you understand your customer deeply. I don't think that corporations in our industry or really our industry partners, sometimes that's like a missed opportunity. So it was easy for me. I was the customer. So I knew who I was building for. And our clinic was a big clinic. I mean, we're talking about single location, 7 doctors, 9-figure revenue. So there was like a lot of, if it could work for us, it could work for anybody is kind of what we thought. We were, full scope, everything. So what I did is I started to look at the EHR and look at um, maybe where the lowest hanging fruit was. I always look at like low effort, high impact first,
Mm-hmm.
and see where you can build out certain features that can create efficiencies. And I, tried to start there. Then I looked at maybe some of the hidden gems that were already in the system that nobody really even knew because nobody knew how a practice would use it. So then you don't really look at that feature as something that is really cool. And then of course the hardest thing, even though EHR is not easy, the hardest thing is actually the practice management system. You alluded to this.
Hmm.
So, making sure that there's a practice management system that could do everything else that a business needs to run itself. So I think, and that, look, even so today, I've built two different EHR systems. I take a lot of pride in trying to indirectly affect patient care that way too. Everything is good. It's good. It's good enough.
Yeah.
It's not great. I mean, I don't think anything's perfect or great. I don't see anybody raving about their EHR. So I never really got to my kind of 2.0 roadmap in anything I built. I never really got there. So I feel like the future of EHR should look and will look very different.
Yeah. Well, and that it probably comes into sort of the discussion about AI, but maybe we don't think about AI, and maybe we can. You should start talking about where you see AI as in. So my mind is like, how can I get something that is super simple that translates every single thing that I'm seeing in maybe a patient note where I can summarize very quickly verbally or through some sort of scribe. And then it takes that information and puts it all in different places so it's organized in the way I might want to read the chart note. And, how do you get that information in real data to be able to say, okay, well, when we see this type of patient, we're likely going to order these tests, or it knows like we're going to order, maybe you still have to order these tests, but when I order them, they're put in the right place so that if we don't get those tests done, they become tracked. And then if I prescribe a specific type of contact lens, then that specific type of contact lens is also automatically uploaded and integrated in some sort of system that can get ordered by maybe the push of one button as opposed to 10. And so like these are the things that in my mind, it's like, why can't an EHR function like that? And I know it's because the complexity of how I might want to word things, it's not been fluid enough to be able to do that. But that's where AI, well-trained AI, can probably come in. So break down and maybe I'm wrong, but break down a little bit about the AI systems that we have now that people are used to using, how we define those systems, what they're probably useful for, but also what might their limitations be.
Yeah. I'll try to simplify this in a little bit. I think a lot of what you said I agree with. Some of it is automation, which has been around for forever. Actually, even the term artificial intelligence was first coined in I think 1956, right? So it's been around for a while, but a lot of it was automation. I mean, these machines weren't smart enough to problem solve, to reason, to have logic, and all of that good stuff, right? That's how we got to where we are today. And I think now when we talk about AI today, I mean, we're talking about back end tools. So in kind of the world of software, we look at those as back end tools, tools that can do some things in the background, then hopefully present you something as a user, present you something that's useful or hopefully solving a problem. A lot of these things are powered by humans, right? So they're co-pilots, right? So a prompt has to start by a person, and that person then has to, make sure the prompt is well structured, and then the back end tool will go do what it's doing. And we're talking about large language models. We're talking about familiar brands that we know, which is OpenAI, Anthropic, Gemini with Google, all of these things. So those backend tools will, of course, do their thing, and then, without getting into too technical of terminology here, and then present something to the user, and hopefully it answers their question. And of course, we can build on that. Now, these are backend tools. What we're seeing now currently is we're seeing agent to agent. So we're seeing now a machine that's smart, right? An artificially intelligent machine that can now interact with another artificially intelligent machine, and then hopefully the two can help solve problems. So that's very
And that would be
interesting. And
without a prompt. That would be without a prompt.
yeah, if they're trained, it'd be without a prompt. They know
So
what their rules are.
so then let's go back a little bit sooner or before that and talk a little bit about the large language models. So like how are
Okay.
these built? Give some people, again, you can get as technical as you want. I mean, I think there's just a lot of people that have uncertainty about what Gemini and what Copilot and what ChatGPT, what are they actually doing, and like where are their limitations? So tell me a little bit about those large language models and how they're built.
Sure. Yeah. I mean, a lot of it's just again, the data is the fuel for an artificially intelligent machine to be able to do what it needs to do, right? So you need data. Large data sets. These large ones, these super large ones like OpenAI's. chat bot, right? Like all these chat GPT and these things like this. These guys train off millions and millions and millions of data points, and they're basically, scraping the internet and has everything that the internet has. Some of it is not really up to date. You could say, okay, some of those data sets might be from 2018, some might be 2020, some might be 2022. We're in 2025 today. And the more recent ones and newer ones are going to have more newer and more useful information, which leads to another problem, by the way, because we've been using AI for a couple of years. And if the new ones, follow me here, if the new ones start to use data that's more recent, some of that data is artificially intelligent data. So
Hmm.
there's some what we call cannibalization in
Hmm.
the AI space. So then what you go is like, well, that old data was actually that was important because that was actually, humans,
Ah,
research, all these
interesting.
things. Now there's kind of data cannibalization, we say, with some of the newer data, maybe not always the most accurate, right? So we look at that too. Now, without getting off track too much, with all these data sets, basically with complex algorithms, a lot of mathematical functions, all the data, no matter how, and it's multimodal, so no matter how it comes in, some of it's video, some of it's text, some of it's images, whatever it is, all those get essentially translated to ones and zeros, right? Translated to numbers. And those numbers is really where mathematical functions and complex algorithms kick in. And what happens is then when you put a prompt in, and you might put a prompt in that says, fill in the sentence for me. Um, Masood loves to X, whatever it is, fill it in. And, based on what data it's been trained on, it may know the answer, it may not know the answer. So you asked the question around limitations. We've seen this all the time. How many times do we get frustrated with asking Siri a question and Siri has no idea what the heck
Yeah.
to say? And it's frustrating. And then, or even worse, instead of saying I don't know, it gives me a completely different answer. It's like, oh my gosh, just
Is
stop
trying to
talking, stop.
please you. Yeah, like all these AIs, that's what I hate about them is like even the ones I train. So like even my GPTs that I train to do specific things, it's
Yeah,
always trying to give me like it'll try to give me an answer that it thinks I want instead of an answer like the correct answer. You know what I mean?
it's context.
Why does it
That's
do that?
right. Well, it doesn't have all the context, right? So it only knows what it knows. So again, it goes back to limitations. You go, all right, how come it doesn't fully understand what I'm saying? Well, because it's not as human as intelligent as a human being, right? That's when you start getting into artificial super intelligence and artificial general intelligence, and artificial general intelligence, or AGI, is known as when then these machines are actually smarter than human beings.
Hmm.
We're just trying to get to a point where they're as smart as us, and even that is a scary thought for most people, but the limitations are around context. So, when you start thinking about how we're using this today, it's like a lot of natural language processing, a lot of really text, right? It's a lot of text and a lot of voice is how we interact with these tools today. Over time, what's going to happen, I believe, is you're going to see these agents, okay, these artificially intelligent machines that then interact with users in a very intelligent way, and it's going to get better and better. But let's go back to the point, kind of how these large language models work, to your question. So then what happens is you put a prompt in, Masood likes to blank. It's going to go back into its data, and let's just think of it as vertically stacked bunch of data, large language model. We're talking about millions and millions of data points. It's going to go find anything that's relevant to Masood likes, and that's kind of all I gave it. So Masood likes, and then I'm going to go, okay, first of all, who's Masood? So
Yeah.
then it's going to go look up every Masood, and hopefully you would hope it finds the right Masood. Now the good thing is there's only one Masoud Nafey in the U.S., but still,
Really?
yeah, in the U.S. I guess. I mean, that's what I saw. Who knows? Kids are being born every day. Um,
Yeah.
but maybe you say Masood Nafey likes. Let's, for the sake of this example, Masood Nafey likes. So then it'll go and what's called vectorization. It's going to go look at all the data and kind of find the mutual points of interest and things like this. Basically, going to go and find data that's relevant to Masood Nafey. Then out of all that data, it's going to then look at that next term in the prompt, which is kind of likes. So what are Masood Nafey's likes? And then it might find that my Then high school, Masoud was a captain of the football team, and he did a little commercial for the local sports, whatever, whatever. So then maybe you'll find that and say, Masoud likes football, and it'll give you an answer.
Mm,
Or it might see that, Masoud loved, he played on a traveling basketball team. He loves that, blah, blah. You'll find that Masoud likes basketball. Or it'll find that maybe I was a collegiate boxer, blah, blah, blah. Oh, Masoud likes box. So then it would say, oh, Masoud likes sports. That's a safe answer. So then
mm,
that's the kind of from your input, that's kind of the answer you'll get, the output you'll get. So that's a very, again, it's not very, very technical, it's very high level, but it's kind of how it uses that data to then find relevant information, ensure accuracy, and then provide an output that can answer the question. But then you might go, I didn't want to know about sports. I was talking about Masood's professional. Well, you didn't provide enough context in your input.
right.
And that's where we get frustrated.
Right. So then what about like hallucinations? So why it seems like it's happening less and less, maybe just in general, I'm seeing them less and less but like, again, when I try to build, GPTs that kind of do a specific thing and allow me to play with ideas. I'm trying to build it
Yeah.
with the intent of like do the stuff that takes me a long time first automatically, so I can just
Yeah.
give you the information I want, and then give me the stuff that I need, and then I get to play with it. So then my mind gets to say, well, what about this, and what about that, and what about this, and that's something that I can't get a GPT nor to do yet, but sometimes it just starts to hallucinate where I'm like, you know how to do this. Like, you know how to make these calculations. I've taught you a whole bunch of times. What's going on there?
Well, AI hallucinations has a negative connotation to it. It's actually a good thing too, and I'm going to speak to that. I actually believe it's part of a product feature of large language
Hmm.
models and kind of how we interact with them. If it wasn't for some hallucination, if it wasn't for some hallucination, we wouldn't get any creativity. So I
Hmm.
like to talk about it like this. On a scale of 0 to 100, we don't want 100 hallucination, but we don't want zero either. We want some creativity.
Right.
Or else, why do I need you to do this for me? So we want somewhere in the middle, a nice, happy balance. So then it can get creative enough where generative AI
Hmm.
can produce something for you that you might like. And those are the things we actually love seeing. That's actually when this term artificial intelligence actually blew up, when people start seeing images. It wasn't around like text and things like, because it was that happened for years. It happened. I mean,
Hmm.
Google Maps was telling me where I needed to go before I knew where I wanted to go. That was happening. But then when the images came out and generative AI started to really blow up, people were like, "Oh, this thing is powerful. Oh my gosh, it's creating images for me. It's creating videos for me." And then sometimes it got carried away, and that is the bad side of AI, right? That's the hallucinations you're referring to, and that also is, it's a problem for sure. So it goes back to um, accuracy, right? Bias, right? So it could be biased. Then you can start to create rules around it. So you say you've seen less and less of it. So perhaps there's been more rules and
Hmm.
boundaries around what it can and cannot do. And, just like a child learns, and you have children, I have children,
Yep.
just like we teach our children through mistakes, large language models learn the same way. Machines learn the same way. They learn through their experiences, so they will get more accurate over time. So, of course, just like like this other day, actually, I couldn't find my favorite toothbrush this morning because I have no idea what my son did with it. So, of course, don't worry, I found another one. But,
Your favorite?
like I was, yeah, the one I use every
Like,
day. So,
most of us, Masood, have one.
yeah, that's true. That's true. I have one too, but I have another one just in case, and I didn't know I'd use it because my child would lose it.
That's
But
awesome.
I would have to have a conversation with him, right, and teach him something. So hopefully the next time he doesn't do it, that's Dad's toothbrush, right? He needs to brush his teeth too.
Right.
But like machine learning in similar ways.
Yeah, well, and I see your point. I mean, and actually, that's what I think the next phase is, and that's why I want you to kind of dive into agents. But if I've got my GPTs running on full cylinders, what that means is they understand how to analyze the data, but now it's not just me thinking about how to think about it differently. I can actually play with it. So where am I missing information here, and where should I be thinking if this is how my brain is working now, what other things can we use in that data or to help solve the problem of the office? Or and now it has to hallucinate a little bit in a good way. But first, it's like the hallucinations are frustrating when I'm starting to build it, but then over time they could be really valuable because now I actually, I don't like the idea of having a conversation with AI, but fundamentally I'm not quite there yet. But sort of like, what am I blind? Like, where are my blind spots in the things I'm looking at, and how can I expand my ideas related to what we already know and how I want to ask you questions?
Yeah, I think I kind of understand where you're going with this. So, forgive me if I don't answer it fully, ask me again. But I think it's more around how do we train these models to be more specific to our environment?
Yeah.
And there's this concept called fine tuning, which is really the way you personalize your own large language model to essentially learn more about you, so it could have enough, or I should could have more context around you, so then it could be more useful to you. And what's funny in the world of AI, I think, there's a lot of things that we predict will happen, a lot of things that we think will happen. One of the things that I think is definitely going to happen is we're going to go from large language models to small language models, very specific language models that just have the data that you are looking for. It doesn't need to know everything that's on Wikipedia. It doesn't need to know everything else on in the encyclopedia, if those even exist anymore, right? But it doesn't need to know all of those things. That's what large language models are trained on, data that's everywhere and lots of public data. Now, of course, then you talk about privacy, and when we start talking about healthcare, we have to talk about privacy. So, but I don't want to get there yet. But just to answer your question, you have to essentially fine tune your model to have all the context that you want it to have, to hopefully then solve the problems you want it to solve. Because if it doesn't know, it cannot answer, right? So it's just like, again, I have a 2.5 year old. If I ask him to, solve an algebraic equation for me, he's never been taught. He doesn't, I have no idea what that is. And I swear he'll look at numbers and say ABC, right? So, so that's kind of what will happen. But now it's the same with these machines. It's the same thing. So once we are able to fine tune and personalize these models for us, it's going to get even better. Then it goes into the next point, which was agents. Agents, these AI agents, can essentially start acting like humans, human like machines that go in and hopefully, in our world, we talk about clinics and practices and things like that, go in and get the data that you want it to get. And you don't know if those data points are, to the term you use a lot, which I love, which we don't know if those are your blind spots, or if it's things you already know. It doesn't know that. You're just telling it, go grab XYZ data. Here's where you'll find it, and you got to again, you got to teach this thing. It's like a wild little animal. Like, tame it, tell it exactly where to go, tell it exactly what to do, and then once it learns, it could go everywhere and get it to you in 2 minutes. Talk about efficiency.
Mm.
Now you have that data. Once you have that data, then you can ask it questions and know that it has the context, and then be able to get the responses that A, you're looking for, and B, at the time and the responsiveness speed that you want.
Where do you think in optometric practices they're going to start using agents first?
I don't know. I have
Really?
no idea. Yeah, I don't know where they're going to use agents first. Like, first of all, actually, no, maybe. I think I should say I
I
haven't
have an
thought about it.
idea. I have an idea.
Phone calls,
Yeah, that's
easy
what I
ones.
think.
Yeah, phone
Yeah.
services. Now, there are a lot of voice IP technologies today that are starting to do this, and essentially they're picking up the phone for the front desk, and the reception is not having to do that, and they could take care of checking in, checking out patients that are really there. Again, focusing on that human to human interaction. Technology taking on the rest. So that already exists. Um, I don't think it's necessarily AI agents essentially yet in our space, but it's definitely going to get there. And then it could triage. Are you looking for an appointment? This and that. And all of this is good right now, but it's not great. So that's why I think when you start getting to agents working on the front end, on the user interface, where the customer or that end user is actually at, that is going to be where we're going to see a mass adoption. When
Yeah.
all these back end complex, confusing tools start to affect the front end and where users are actually interacting, it's going to be more real to anyone who doesn't really even know AI.
Yeah. Yeah. Well, and it's going to be, I mean, what do you think? A year, 2 years before somebody can call and an agent has been well trained to know exactly how to triage a patient, how to follow up, how to schedule, what part of your schedule, like all the things that you'd want in a perfectly functioning human that's answering phone calls and also following up with patients who need, like, patient calls in or has an email, like it could probably, I have enough audio that it could make somebody even think they're talking to me. Now, whether I want that or not, my guess is it's pretty close. So are we talking a year, 2 years, 5 years before we have something that's probably able to answer the phone, schedule appointments, confirm appointments, all that kind of stuff,
This already exists today.
but in a
So
good form,
right. So
one that we want to
I
use?
was I love when we have these conversations, Chris, because then it's like we assume our staff are perfect. I mean,
Yeah.
they're not either. But you're right. Like, is it good enough where I trust it with all of my customers, with all my patients, with
Does
all
it
the people
exist
that
now where
interact?
you would?
Um, I think the possibility of it being good enough, if trained well, does exist.
Hmm.
But you're talking about tools that exist that are ready for everybody to use today. All I need is a license, and I have a SaaS platform I can use. There's not a lot of that today. And you know what we're seeing? We're seeing, especially as we look at the investment space and the AI space, because I do a little bit of due diligence on AI companies. We're seeing a lot of folks that take all of these existing tools because nobody wants to compete. I'll say very few people want to compete with OpenAI. Very few people want to compete with Google. Very few. So they're not going to build the models. What they're going to build is this layer above
Hmm.
that says, here's how we will interact with these models and then solve for a very specific solution in a market that we know very well and essentially ensure there's product market fit. But that's the company. Now, that
Yeah.
company only exists because of the backend tools. So if those backend tools, and this happened actually when OpenAI started to really get robust in what it can do, and with their models, what they can do with their models, it took some companies out of business
Hmm.
because what they were that layer that they were building on top, it's like, oh, OpenAI can do that now with including your subscription.
Yeah.
Oh, so then that's the risk. But I'm sorry I digressed a little bit, but it's kind of it is relevant to a degree. I just don't think there's a lot of products out there that everyone can use yet, but soon.
Yeah, it's interesting. It's interesting because like it brings me back to the idea of like my car, my next car that I buy. My guess is my next new car I buy will probably be a Tesla because nobody else right now is in the space of getting me from point A to point B without me ever having to touch a pedal or a steering wheel.
Yep.
And lots of nice car companies exist. They have some nice autopilot-ish functions, but basically it holds a lane, it slows down, it speeds up, and it can change a lane. But it can't stop at a stoplight and make a right turn, navigate. So those are where my mind's going is like, okay, well, can I get to the office where I have a half hour of time to review my charts, to get myself prepared? Well, I remember years ago Elon Musk saying, in order for the public to trust that system, we can't just be as good as humans. We have to be 1,000 times better, 1,000,000 times better. And that's kind of what my brain is thinking about. It's like, if I'm just replacing a person answering phone calls so that I can work with the human portions of the interactions in the office, to your point, it has to be 1,000 times better than the person answering the phone call right now in order for me to switch over. Now, I don't know why that is, but it is true in my brain that like, well, if it's just one, if it's just as good, I'm still going to use a human. But for some reason, it's got to be, exponentially better. Why is that? Why do we think like that?
I don't know, and I don't agree with it.
Oh, you don't agree
I
with it?
I don't agree with it. I
Do you
actually
agree
think
that people think like that though?
I do agree with
Yeah.
you. I agree
Yeah.
with that people think this way. Absolutely, I agree. I just don't agree with it.
Yeah.
I say, look, if you can do the job as good as me, or even close enough, I'm pretty good with it most of the time. Again, it depends on what you're dealing with. Some things are more sensitive than others. Like you, like if I have if I still have my practice and it's like it's answering phone calls of every one of my dear patients, I would be a little more selective. I do want that to be a very polished experience. So that's different. But some back end tools that can help me, heck, if it could be 80% as effective as my current biller,
Mm,
I'd be okay with that. As long as you know also this machine or this agent or whatever the tool is also knows how to solve for the problems when the 20% of the time it doesn't know or it doesn't do it right. Hey, why not? By the way, huge opportunity in RCM space, right?
yeah.
That's like a no-brainer of where it'd be used. No-brainer. Like absolutely no-brainer. We could talk about that another day, but I don't know. I don't know why. So for example, I pre-ordered the Tesla Cybertruck uh years, like I'm literally when it came out before Elon was a political figure, all of that, right? And I was one of the first to get it. I'm also based out of Silicon Valley, so I was one of the first to get it. I love that truck. I never thought I'd love that truck. I'm a V8 guy. All my engines are V8s, all of my cars. And I
Yeah.
got that truck
Amen.
and I was like maybe I'll resell it. It's okay. I fell in love with full self-driving. I fell in love with all of these things. Now, even full self-driving, is it 1,000 times better than me? No, but it's smart and it's good. And honestly, I don't, I just pay attention. I'm like this. I
Yeah.
pay attention and that's it. And of course it does track my eyes. So if I don't pay attention, it'll shut off. But
Ah,
um also some creepy stuff there. But like it'll do those things, right? So then, but I love it. It's one of my favorite vehicles to drive now. And I'm a car guy and I love all my cars. So surprised that it's one of my favorite vehicles to
hmm.
drive. But I didn't need it to be 1,000 times better than me. I needed it to be as good as me. So then it could just do my job. So then I could do something else and focus on something else. And it's great when you have crying kids in the back that are distracting you 24/7.
Yeah. Yeah, totally. All right. So, okay. I want to dream a bit because I think we've got some enough of maybe what exists right now or even in the short term future, but let's
Yeah.
dream like long term. Okay. What people are kind of worried about.
Okay.
So, um, should we be worried about being replaced as doctors at some point in the future?
But sometimes when people ask this question, I go, when you like some of this technology exists today. We were worried about this when telemedicine came to play. We were worried about this one. And like as a patient, like since I'm a patient too, I don't really enjoy those experiences. There's something missing to it. And I know what it is. It's the human element, right? I like going to somebody who can be an empath to my concern and actually look at me, understand my body language, and I could build a connection. I could build a connection with that human being. I love those pieces to it. So then to me, no one's going to replace that primary care physician that I built a relationship with. How can you? So I think a lot of our patients think the same. I do believe our patients, and this is where the gap is, in my opinion. In today's Amazonian consumer environment, where we found things can be more convenient, and then there's practices and industries in healthcare that have stayed in the dinosaur age of convenience. I think that people will want us to be more convenient and have things be more accessible to them and for them to have more freedom on kind of how they book their appointments and how they get their glasses and all of these different things. I think that there's definitely room for technology, especially AI, to help with. But then when it comes to the actual doctor patient interaction, sure, sometimes, yeah, there's some convenient components to it. But I think overall, no. Also, look, some of us love going to GPT, love going to Gemini, to Claude, and then like asking questions around symptoms, getting answers. But even still, in the back of our mind, we go, I need to check with my friend who's a doctor. So there's a little bit of a trust element here that probably will never be solved. And how many times you talk to a doctor and you love it and you appreciate when a doctor goes, I don't know, but I'll find out for you. Um, these machines don't do that.
Yeah.
They don't do that. They'll either give you wrong information or they'll give you right information.
Yeah. And you got to figure out which one it is.
Yeah.
All right. Next question. When do we become those who are serving AI and not the other way around?
When do we become those who are
Yeah.
serving AI?
Yeah. Yeah. So, like, that's kind of one concern. It's like, you know, at some point, artificial intelligence becomes so intelligent that we're the ones doing the work for it and not the other way around.
Oh, I see. Um,
You're not worried about that?
where they could just do it on their own.
Yeah, or we're the ones that are feeding them information so that they can do the jobs that they want us that they want to do, and we're doing the jobs that they want us to do.
Yeah, I love the us and them
Yeah,
already
I know. I
points.
know. I heard somebody
um,
tell me that like you should talk to your AI like it's like I mean this is bad, but like it's a slave. You know, you should talk to it not like you'd talk to another human. Because it prevents this brain of like thinking, oh, this is just another person that I can communicate with, and it's exactly the same as communicating with Masoud, you know?
okay, that's funny, Chris, because I saw a meme. I saw a meme that said, year 2050, where robots are taking over, like iRobot, right? The
Yeah.
movie, and robots taking over, and then they see Chris. They see Chris Wolfe, and they have a gun to his head, and the other robot goes, "Stop." He always said please and thank you.
Yeah.
So,
No, it's pretty funny because I still
so
do say please and thank you.
right. It's in
Yeah.
our nature. So,
Yeah.
there are going to be certain things where they will help us and replace what we do. It also depends on what we believe are our, as human beings, as optometrists, as doctors, as professionals. What are our sustainable, irreplaceable competitive advantages? They'll never. A machine will never be a human, never. So what are those human components that actually make us and differentiate us so much where we will always be better? Then now there's that piece. So there, I think that piece is super important to actually have a discussion around. Then you have the other piece, which is like, what do we actually want them to take on? We have been data collectors our whole career with patients, and we won't admit it,
Hmm.
we will not admit it, but we've been data collecting. And then ultimately, we spend a few minutes at the end talking about connecting as a human being. We connect the whole time, but a little bit at the beginning, but especially at the end, we start connecting, we start relating, we start being empathetic, we started doing the things we love, which is now I'm going to take care of you. I know what I needed to know. Now I can take care of you. I think there's an opportunity to eliminate all that I know what I need to know 10, 15, 20, 30 minutes, whatever the practice does, to half that.
Yeah.
And then the
I
doctor can
agree
spend
with
the
you.
rest of the time.
I agree with you. Totally agree with that.
So
How
there's
does that
some of
get
it we want
prevented
them to do.
from? Yeah. Yeah. I mean, I totally agree with that. Okay. So last question. I'll be respectful of your time then. So does, like you think about the Matrix, when you and I are growing up, that's a popular movie.
Oh, yeah.
But and these AI take a lot of energy. So they're talking about, like server farms that, we've got farms in Omaha that are just massively sucking on our energy production. So like fast forward 50 years. So you said 2052, so let's go to like 2075. How do we, what do you think happens then? So 50 years in the future, AI, machine learning, power, are we hooked up to this to this matrix and we're feeding the power and the energy for the matrix?
Yeah. Right. Well, it's interesting. There's a lot of things that this is where, like, oh, maybe a futurist can be better to answer
Yeah.
this question. I'm more of a present or type
Yeah.
of guy. I talk about what's here and now, but here's the thing that we also know. We do know this. We talk about kind of, you said, all the power that's required to power all these tools and whatnot. And like Google built nuclear plants. Like they invested in nuclear plants to power their large language models and their AI projects. So you
Mm,
go, oh wow, that's crazy. Well, when you
I
go
don't think it's
back and
crazy.
here's what's going to happen. What we're seeing already is we're realizing it sucks too much power. So things are going to get more efficient. It's getting way more efficient, and it's getting efficient fast. So I don't
Mm,
think that we're going to be worried about that forever. I don't know how fast. I'm not an expert in energy, but I definitely think we won't have to worry about that forever. See, like one of the things was the large language models to small language models. Just get the data in there that you actually need. You don't need large data sets, excuse me. You just need relevant data sets, right? And accurate data sets. So there's that piece, which will also prevent hallucination and also prevent, information, the outputs that you don't want, those things. But then there's the other things. Now we're getting into a world where you have local AI. So, a lot of AI models today are connected to the internet, right? Which leads to privacy issues because when I feed something to, as like a general user, if I feed some information to OpenAI or a large language model, that information then can be trained upon. That is a new data set for them, and it's getting smarter. That's not going to work in healthcare unless you completely de-identify and those types of things. There's a lot of privacy concerns to think about. The world's actually going to move to local AI systems. So there will be a time where you have, and it's not that far away if you ask me, in the next few years, there'll be a time where you'll have your own local large language model, and maybe not large, maybe small, who knows, but you'll have your own model right here on your device. You'll have it locally. So then that what that does is allows you to have faster computing, less energy required, and get the answers you want faster.
CooperVision and the AOA have joined forces in a groundbreaking initiative to transform how optometrists treat children with myopia. The Myopia Collective aims to unite our profession and its allies to challenge the status quo and elevate the standard of care for children with myopia. Everyone is invited to become a member of the collective. By joining, you pledge to act in slowing childhood myopia progression. Membership includes regular updates and information about the collective's efforts, access to educational opportunities and resources, and insights from the ambassador optometrists who advocate for community policy and changes supporting the collective's mission. Click the link in the show notes to join the collective today. So let me ask you this then. If I have, if you had, so we've kind of gone all the realm of discussion. What's one thing that a practical thing that somebody that might be dabbling with AI can use in their practice right now to improve efficiencies or get better data or interact with their patients better? What do you think? Like one thing that they can do tomorrow if they're not already doing it?
Yeah, I've done this question before. I think, it depends on whether they're going to use a tool that's already out there and available for their practice versus them dabbling themselves into this space and trying to see where they can find efficiencies for themselves. So I'll go with the latter versus
Okay.
kind of promote a product.
Okay.
So
Yeah.
with the latter, I would say I think it's important for people to actually start dabbling, like start looking at just, even if it is just one of these Copilot tools where you're just going to talk to, whether it's Microsoft Copilot, OpenAI's Chat GPT, or any of these Copilots, you go and talk to it and you ask it questions, you kind of start to learn and anticipate kind of how they respond and those things. That's like step one, just dabble. Then you have step two. All right, maybe you want to subscribe and have your own little copilot, and you want to fine tune that and start to personalize that around something. It could be clinical. Like I think like what you could do is, let's say I have a glaucoma copilot. I'm going to tell this copilot, you are an expert in glaucoma care, treatment, everything. You are also now fully up to speed on all glaucoma studies. And maybe I have a place where I can get all the studies and I'll load it in and I'll tell it, learn everything you want,
Mhm.
you can learn from this. Okay. And then you go, and I have a case. I have a patient. I have a case. So I'm going to present that case to this copilot, and it's been trained off all the studies. So it's going to give me a data-based answer, right? Like a data-driven answer, which is
Mhm.
perfect. So even clinically, I can train this thing to tell me, all right, I have this patient, 56-year-old. Here's their CD ratio. Here's their IOP. Here's blah 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 blah. And then all of that, how would you take care of this patient? What's the follow-up schedule? What's the treatment plan? And all this. What's the diagnosis? Um, and see what it comes up with. You'd be surprised.
Oh yeah. Yeah. Well, I think it can give you added perspective and helpfulness, and then as you make it better, even if you can say, hey, remember that patient from, obviously HIPAA comes into play, but you could just label the patient with some sort of arbitrary code, right?
Of course,
And remember
de-identified.
patient 453331. Now we've got this new visual field. Will you analyze this visual field and tell me what the next steps are, right?
Mm-hmm.
Help me with
Mm-hmm.
this. I'm uncertain.
Yeah.
Yeah.
And even if it's wrong, you could say, look, I actually diagnosed this patient with so and so and with this condition, and I will follow up regularly. And then, now you could even teach it, right?
Yep.
If it makes a mistake. But, you'd be surprised these things are pretty accurate once it gets the right data points.
Yeah. Yeah. That's great. All right. So, Dr. Nafey, where can people, if you want people to reach out to you, where can they find you? And thanks for doing this.
I appreciate it. Thank you, Dr. Wolfe. I mean, it's always great to spend time with you. I always learn when I'm spending time with you, so I appreciate that. I'm sure all of your listeners do too. LinkedIn, I'm easy to find on LinkedIn, so I always respond to anyone who's not trying to advertise something to me. But definitely happy to engage with anybody. I always enjoy that.
Awesome. Well, thanks for doing this.
Thank you so much for having me. It's been an honor.
You're welcome.